is a member and voted. Council includes closing Langer and Fiskerton Tips youth centres, care homes, respite centres, the list could go on. So don't believe that the Labour Party really cares about our area. The history of Nottinghamshire, very tragically, is that when the Labour Party get in, they don't care about the rural areas and the market towns, and Newark always loses out. But the wider point is that social care matters. It matters to all of us. We've all, or most of us, have had elderly relatives or children in need, and it needs to be properly invested in a way it hasn't been by governments of any flavour over a long time, and that includes social care, it includes adult social care and mental health, which is something that I think is very important. You may have seen one of my initiatives. I'd like to make Newark one of the first dementia-friendly communities in the United Kingdom, and that's something I'd like to take forward as your Member of Parliament. Mental health in particular has been the Cinderella element of the health service for too long. It's key that we integrate health and social care. I think there is a growing consensus of that amongst all the political parties. It's difficult to do and it's expensive to do. I sit on the Health Select Committee and we worked with a lady called Dr. Barker who's done a review for the government, and it will cost over £3 billion to do it. But I think it's worth doing. It's an important step forward, and the Conservatives have made the first step in that process in coalition with the Lib Dems, who've actually been quite strong on this issue, with the Better Care Fund, which is actually operating pretty well in this area, with some good step forward by Sherwood Forest Hospitals Trust. But that needs to be taken forward as one of the priorities of the next government, so the two are finally brought together.
On my way down here, sorry, my things gone away. On my way down here, down Hatton Gardens, I popped in to talk to John Bartlam and Tara Hobson. Unfortunately, she wasn't there, about Woods Court. My mother-in-law had spent several stays in Woods Court. We used to pay quite a lot of money because we were above a certain threshold in order to benefit from respite care, and she always was very cheerful and came out. She had had a holiday, and so had we. And there was we cared for her for more than 5 years, and in the final 2 years of her life, she lived with us. And so we know all about respite care. We know all about care for the elderly, geriatric care, and everything that goes with it. And I have to say, as a customer, that the closure of Woods Court is a tragedy. And if Michael thinks that he can shrug that off and say that it's nothing to do with him, then I'm sorry, he has to think again. The County Council should have found a way to keep Woods Court open and provide the statutory care that is required, and indeed in future years will be ever more required as the population ages, for our elderly people who should not be thrown out onto the streets just because of, they might say, government cuts. They've got to manage within their budgets, and I've been a financial manager around the world for 30 or more years, know what it's like to manage within a budget. These people are just amateurs. They've been elected to a certain position, and then they don't follow through with their responsibilities. I think it's a disgrace.
Well, yeah, there have been two accusations tonight. I'm not going to shirk my responsibilities, because if you were elected, you have to stand by the... What I'm not proud of is that your government, Robert, and you voted for this, have taken hundreds of pounds from every household in Nottinghamshire, whilst giving hundreds of pounds to constituencies like Surrey and places in the south. You are taking money away from Nottinghamshire County Council and Newark and Sherwood District Council, and you are giving it to southern constituencies, and that's a fact, and people can check it on the Treasury website. The other really interesting point, Robert, you've had your say, is that you are giving money to constituencies where there are Tory cabinet members, surprise, surprise. And that's why Nottinghamshire County Council's in the difficulty that it's in. But let's turn to the real issue about Woods Court. I want to see a genuine integration of social care and acute and primary care in the National Health Service, and I want to see that properly funded. We still have a question unanswered tonight. The Tories have made an £8 billion commitment in the NHS, and they've talked about integration. They haven't told us, even today, Jeremy Hunt was asked 18 times how he was going to pay for it. They just keep saying a growing economy. Ours is clearly funded, 2.5 billion raised by tobacco company levy and a levy on a mansions tax. And the reason we need to integrate social care, places like Woods Court and other places alongside hospitals, is because 40% of the people at the moment in hospital in Nottingham City and Nottinghamshire healthcare trusts do not need to be in hospital. They need to be looked after in the community, or they need to be looked after by social care, which equates to about £200 million. If that money was transferred from primary and acute care into social care, we wouldn't be in the position we were in with Woods Court. If you hadn't taken hundreds of pounds away from Newark and Nottinghamshire and shovelled it down to Surrey and down to the south, we wouldn't be in the position we were in. And you voted for that budget, Robert, taking away money from Newark and Nottinghamshire and then going down to Westminster and shovelling the money out to people in the south. A greater north and south divide. I'll happily stand by my record any day of the week. The Labour government had a proud record on the NHS, rebuilding the hospitals that you left to be derelict since the Victorian times.
Thank you,
Nottinghamshire County Council's budget in 2010 was £576 million. Today, it's £556 million. That is less than 10% reduction.
Chairman, with respect, you've allowed him to come back 3 times now. Helen hasn't even had her say at the moment.
Completely unforgivable. I had use of, when I was looking after my elderly mum at home, I couldn't spend a night away from home without the help I had from Woods Court and for my mum when I knew she was in safe hands. I can't praise them enough. And it's extraordinary. We've got all these cost-saving measures and we've got all these principles about keeping elderly people at home. And how on earth are we going to do it if we don't look after them and their carers and be able to provide respite care? And also, how are we going to keep people at home if we don't pay our carers properly? And in the last 10 years, the proportion of district nurses has gone down by 47%. How are you going to keep people at home if you haven't got those who can visit them and look after them? And I completely believe in the parity of mental health, and we do have to consider NRIght close too. I also want to say though, just to pick up, because I didn't have a chance to come back, on your saying that you'd like to see services back in the hospital that are safe. The only reason that Amanda Sullivan is saying things aren't safe at Newark Hospital is because services have been drained away to Kings Mill and they've removed staff. So if you put them back and we separate that, we can provide proper beds and proper care for our elderly.